Okay, we're going to talk a little bit about goals now, writing goals. This component of goals is really important because we've got to have certain things in our goals now that we didn't used to have to have. And so writing goals, this particular slide is, you guys all know this stuff. It's just my intro to writing goals, but just, I know you know all this. So you're all clinical, you've done this long enough that you know that this is a huge component. You've got to have the skilled, they need to be measurable, attainable, reasonable, and necessary. And the two words that Medicare uses over and over again in their documentation is it reasonable and necessary? That's the most important thing for them, reasonable and necessary. The other components need to be there. They need to be obviously skilled. We just talked about that in terms of the language and the words you use. And it has to be attainable, which also goes along with reasonable, doesn't it? And then measurable. They do want to have a measure in there. How are you going to measure what you're doing? When is it successful? But I do see reasonable and necessary written over and over again in documentation that comes through from Medicare. These are the 5 areas that we write goals in the most, at least for therapists. I think everybody needs to take a good look at that, though, because if you're doing the social work, you're looking at the big picture. And even though some of these are for ST, or some of them are for OT, some of them are PT, look at the big picture. And this is what your patient is going to try to accomplish as a social worker. If you can get that big picture, then you have a guide to know whether or not they're doing well. So communication, we'll talk a little bit about that. As an ST goal, I know that's a lot, isn't it? Well, speech therapists tend to get a little wordy. So, but we'll go through this because I really want you to see the parts. It's the parts that are important. You've got to have all the pieces there. So if you're going to write a long-term goal for communication, here's a good example. We'll utilize a communication system compatible with his or her spared skills. Now, see the word spared skills up there? That goes to dementia, doesn't it? So they know you're working with a dementia patient. That is no surprise to them, and it's fine with them to write a dementia goal specifically for that population. To ensure adequate expression of basic and medical needs, and then by mastery of the objectives, by mastery of the short-term goals, whatever you want to say right there, as long as you're referring down to the short-term goals. So, patient will participate when episodic memory is cued. Remember our episodic memory? So we've got a communication goal, and we're going to try to use their episodic memory to increase communication skills. So what do people do when you talk about the past? They usually talk to you, don't they? So if we're going to elicit some conversation, perhaps out of somebody who has not been verbal, maybe that's a good place to start. Sometimes hearing their own voice cues in more conversation. Speaking of that, I'll give you a good example. The lady who was talking on the screen a minute ago, who was talking about the car. Remember when she was reminiscing about the car and the 8 people that were in it? But then more happened. She started talking about, well, there were 2 boys and a girl. And they were my cousins, and they were family. So a lot more started coming in. When you start using episodic memory, she went way beyond just the question. She started adding more to it as her memory started flooding in about driving in that car with all those people. So that's a great communication starter, is using episodic memory. To increase appropriate communication exchanges 10 times in a session and decrease verbal perseverations. And you don't really need to write because you wanted that particular statement of I want to go home. You could, if that's all the person is saying, to kind of give them the example that this is what we're trying to break, is this perseveration of I want to go home, I want to go home, I want to go home. So that's a good goal, and the parts there are, you're telling them, number one, you're telling them what it is you want or that you're going to do. You're going to you want the patient to participate by communicating. Now, it says your goal is to have communication exchanges 10 times in a session. That's your goal. And why do you want them to do it? Because you want them to decrease the perseverations. So you're saying what you want them to do, What's the measure? And now why do you want them to do this? Why is that important for that person in his setting, in that person's setting? So they don't just want what you're going to do and how it's measured. They want to know why. Tell me why you want to do that. Do you want them to recite the Declaration of Independence? Is that why you want them to communicate more? No. We just simply want to decrease perseverations. That's why we want them to do it. So they wanted to know that you're writing functional goals for that person in that setting. That's what it's all about.